Okay. Before discussing the clavicular fracture, let's check these two questions first. We have here a 23 years old man came to the ER after falling to the ground, pain in the left shoulder, intact neurovascular examination. This is important. AB, AB, AB shoulder X-ray show mid-clavicular fracture with shortening in the clavicle 3 centimeter. What is your management? Focus on this shortening. We will explain soon what we mean by shortening. You have two options: conservative treatment or operative treatment. For now, it is operative treatment, and we will see later why. The next question. Okay. Also, you are in the ER, patient with clavicular fracture came to the ER. You notice that there is tenting in the skin. We will see what we mean by tenting in the skin soon. Tenting in the skin over the clavicle. What is the first thing you have to do? First, try to reduce the fracture by compression, or order AB X-ray for the clavicle, or call for orthopedic regist, or check the radial pulse. Of course, the answer here will be a safe doctor, check for radial pulse, and this is important. Now let's go through the clavicular fracture. Okay, this is the clavicle. Here the sternoclavicular joint. Here the acromioclavicular joint, AC joint. Okay. Here is Dr. Ullman classify the clavicular fracture into three parts. The name is Dr. Ullman. Remember this. The most common site for fracture is the middle 1/3, is around 80%. The next common is the lateral 1/3, is around 15%, and the medial is around 5%. Here is middle clavicular fracture. Okay. Okay. What is the most common mechanism of injury or fracture? Fall into lateral aspect of the shoulder is the most common. Next is direct impact to the clavicle. Why the middle third is the most common site for fracture? Because it is the thinnest part of the bone, and also the neurovascular bundle for the clavicle enter through this area. If you see in this X-ray, you can see that here is the middle part and here is the lateral part. The middle part pulled up due to effect of which muscle? Here is muscle called sternocleidomastoid muscle inserted here, which pull the clavicle up. While in the lateral part, you can appreciate it that it's depressed, or the lateral fragment depressed by effect of pectoralis major muscle and also weight of the shoulder and of the arm. It's called the lateral fragment down. Here is why you can see buttonholing or injury to the skin over the clavicle, usually due to the middle fragment, as it is go up by sternocleidomastoid muscle, as we mentioned. Next thing you have to understand, if you see any clavicular fracture in the question, first you have to check if there is any pneumothorax. This is important. Next one is if there is any brachial plexus or any vascular injury, especially subclavian vein, which is the most common as it's superficial in the neck. Next, this is the vein. Next, artery come after the vein. So you have to check for any hematoma or any loss of pulsation as radial pulse, as we mentioned in the first question. Of course, the patient may have rib fracture, or if it is associated with scapular fracture, this is what we call floating shoulder. Like you have to understand what is the meaning of floating shoulder. This is the clavicle and this is the scapula. If you have a fracture here and the fracture here, especially after the neck of the scapula, the shoulder will be floating. Okay. What about the presentation in the question on in the real life? Let's check this photo. This is what we call tenting, like a tent. Okay. Usually they will mention in the questions that I heard the popping or cracking sound near my shoulder. Acute onset usually. Pain. This is okay. Physical examination inspection. You will see tenderness, swelling, crepitation, deformities over the clavicle, skin tenting, and it's okay. You may see open fracture here, like the bone out of the skin. Assist subclavian vessels and the brachial plexus. Also, this is important. Now let's go to the management. For a medical student, it is not important to dig deep in the management area, but you have to know the broad line. We have two types here of management. The patient could be conservative management or operative management or operative treatment. Conservative, we have two forms of conservative management. Maybe a sling like here, arm sling, or figure of 8 like here, and research shows that there is no difference between the outcome of both. Anyway, a sling is more adapted to the patient, less painful to the patient, so we prefer a sling, but either way it is good, both of them. What are the indications for conservative treatment? When to go for conservative treatment? First, if there is shortening less than 2 centimeter, if it is closed fracture, they mean no skin injury, and of course, if there is no neurovascular injury, and in low demanded patient, like a very old patient, not active, and so on. How to measure the shortening? It is that easy. All what you have to do is you may take X-ray for both shoulder and measure how much it is shorted from the medial end to the lateral end, or the area of displaced here. You can see, you can measure how much. If it is 1 centimeter, it is this is shortening. 2 centimeter shortening. This is conservative treatment. If it is more than this, it will be like 3 centimeter. It will be operative treatment. Of course, this is area of debate. Maybe there is a rule for cosmetic operation, like the patient don't want any sign of collection or any sign of thing here, so you have to go for operative treatment. What are the options for operative treatment? Let's check here. Operative treatment, you will do open reduction or closed reduction with you can fix with a plate and screw like in this X-ray, or you can do with intramedullary nail like in this X-ray. What are the absolute indication for operative treatment? You have to know only for the absolute. First, if there is any open fracture, you have to do some debridement and clean the wound and fix. If there is displaced fracture with skin tenting, if there is subclavian artery or vein injury, or if there is a floating shoulder, as we mentioned before. Here is some other relative indication, but nowadays there is a growing trend toward the operative treatment for clavicular fracture for more cosmetic, as I mentioned before. I hope you get it. Thank you.